Obviously not a midwife here. I put in an abstract to talk to you about nutrition, and I've got a very short window, a much shorter window than I'd hoped, to talk to you about nutrition in pregnancy particularly. So thank you. I'm a registered nutritionist, which means I'm registered with the Association for Nutrition, so all the information that I give to you has to be evidence-based or they can strike me off the register. I've had over decades experience, so I'm still learning. I have 2 children. I have experience of being pregnant, I've got experience of childbirth. I can share those experiences with you. I'm not going to, but you all have experience of food, you all have experience of eating, of cooking hopefully, which you can share with people. But as health professionals, whatever information you give about food, people will look to you as the expert. And so there's a challenge there to make sure the information that you give is evidence-based. Now, I studied for 3 years just on nutrition, so I'm not expecting you to know as much as I know about nutrition. Hopefully you'll know some of that, some stuff. But today's talk is to kind of give you an overview of where we are in terms of the kind of nutritional dietary intake of a population, particularly those who are women of childbearing age and pregnant women. Then to look at the advice that we should be giving pregnant women around nutrition, why that's important, and hopefully some opportunities to put that into practice. I am a realist. I recognise that time is really short, and there are lots of barriers to healthy eating, so I can't cover all of that today, but hopefully it'll give you an insight into what we're doing. So where are we? I'm going to start with the really obvious. There are a lot of women who are overweight and obese, and that is an issue, as you well know, in pregnancy and for the outcomes of pregnancy. But I'm not going to stop there, because actually healthy eating and physical activity are for every woman. Everyone who comes through your door needs to have good nutrition advice. We know that about 42% of women are not achieving the physical activity guidelines. So that's not just those who are overweight and obese, that's other people too. And physical activity is really important. We'll come on to that. Then looking at the sugar intake, there's been a lot in the news about sugar recently. Huge statistic. This is only 13% of people manage to achieve the recommendation for total sugar. That's a tiny number of people. So if you think about the 87% that don't achieve it and the implications of that, we've got a lot of work to do. Then fruit and vegetables, our kind of average intake is just over 4 portions a day, and only 31% achieving the 5 a day recommendation. And you may have heard in the headlines that actually we should be getting far more than 5 portions. We're going to stick with 5 because we still haven't got to 5, but that's why we need to push the fruit and vegetable intake. And fibre, the Scientific Advisory Commission on Nutrition changed the recommendations around fibre. We should now be having 30 grams a day, and the average intake is about 19 grams, so there's a long way to go. And then a couple of micronutrients. So we all know in the room about folate. So the folate is really important for reducing neural tube defects. That's why we encourage supplementation. Over 90% of women of childbearing age are not achieving their folate intake to reduce their risk of neural tube defects. So a really important thing to bear in mind if you're working with women before they get pregnant, to encourage them to increase their folate intake. And then iodine. Iodine deficiency increases risk of cretinism, and many people are not anywhere near their iodine levels. So whistle-stop tour, I recognise I'm going very fast. And then salt. Again, lots of stuff in the news about salt. We are coming down with our salt intakes, but we're still a long way off the 6 gram a day maximum recommendation. And then the food trends are changing too. There's vast numbers of people who've decided to become vegan. Now, you may not ask the question of the patients that you have, the women that you have in front of you, are they vegan? You may think it's completely irrelevant, but actually, nutritionally, for the benefit of their pregnancy, you need to ask that question. Because actually, as we'll come on to, there are certain micronutrients that they'll be missing out on, which may have an impact on baby's health and their own health. So what are the implications of that poor diet? I'm not saying that every woman that comes to you is going to have a poor diet, but there are deficiencies that specifically cause certain outcomes. And the evidence around these ones is very strong. There are other ones that are less strong. So we know about neural tube defects, we've mentioned that one already. Low birth weight around iron, increased risk of preeclampsia from calcium deficiency, cretinism from iron deficiency, poor, birth defects and poor fetal development from zinc deficiency, and then preterm birth from iron deficiency. So really important that we try and get those levels up to try and reduce some of those risks. And there's growing evidence that a maternal diet during pregnancy can have a long-term impact on baby's health. So that's, they can actually end up with elevated risk of type 2 diabetes, cardiovascular disease and cancer later down the line. Obviously separating that out from lifestyle and everything else is quite difficult, but there is growing evidence around that. So a really important time to get some good nutrition advice for those women. I'm not going to go into obesity in detail because I know that you'll be very well aware of these risks, but elevated risks of hypertension, caesarean delivery, stillbirth, etc. from just being overweight. And the weight gain we don't in this country have regulations or recommendations around how much weight women should be putting on like they do in America, but weight gain in pregnancy can be a predictor for long-term obesity, regardless of where you started with their BMI at the beginning. Fortunately, it's not all bad news. Women have been shown to be far more open to change in pregnancy. I hope you've experienced this, and that's not just what the papers say, but actually this is a really good opportunity to have some very simple messages for women during pregnancy. Just going to spend a moment bearing in mind we've talked about healthy weight. Lots of people think you only give healthy eating advice, physical activity advice to those who are overweight. But that's complete rubbish. All women need this advice, and I'm aware that lots of you are giving nutrition advice in your clinic, so you're not doing any of it. But the advantage of giving healthy eating advice rather than healthy weight advice is that the stigma is reduced. So if you're just giving healthy eating advice to an overweight woman, and you're not giving it to what we call a healthy weight woman, then the overweight woman can feel quite targeted in that approach. But actually, if you're giving it to everybody, then you can say that. If someone says to you, "Oh, why are you picking on me? Actually, my diet's all right," you can say, "Well, this is the advice for everybody." So it kind of reduces that stigma. And studies have shown, with midwives, have shown that actually that's one of the barriers to being able to give that advice, is that feeling of, actually, I'm going to upset somebody, and you're trying to build that really important relationship with them. So what advice should we be giving? I've got 7 pieces of advice. The first one is about eating for 2. So we know that we're not supposed to be eating for 2 when we're pregnant, but society doesn't remember that. But also, we're not supposed to be eating for 2 in terms of calories, but we are in terms of micronutrients. And there are certain micronutrients that are increased, have increased requirements during pregnancy. I can't go into detail with all of those, but I find the way of describing it quite interesting in terms of how we're talking to women about those micronutrients. An example would be calcium, which I've put up there. So if baby doesn't get enough, baby will just take from mum, and mum will end up deficient. And you can describe it to the mum as, if baby doesn't get enough, they will take it from your bones, and your bones will become weaker. That is what baby does, because baby needs that nutrient. But actually, if you're explaining it in that way, it kind of reiterates why it's important to have that calcium. Secondly, the advice that I know you're giving is around supplementation, so supplementation of vitamin D and folic acid. Talk to them about it, explain Healthy Start, explain where to get that nutrient from, why it's important. Obviously, you can't actually ram it down their throats because that's unethical, but encourage them, give them the evidence around neural tube defects, give them the evidence around the long-term implications of vitamin D, and there's more and more evidence that vitamin D is beneficial for long-term health conditions. It's beneficial around depression, it's beneficial around cardiovascular disease, and so actually it's something we should all be taking. The national recommendation is that every adult in this room should be taking it during the autumn and winter months as well. A good opportunity to tell people that. Thirdly, and I'm not going to dwell on this one because you'll know the list far better than I do, of all the things that you shouldn't have during pregnancy, but I want to emphasise that this can feel quite awful to women. You know, if you're telling them they can't drink alcohol, they're not supposed to have too much coffee, they're not supposed to have this and that and the other, it can feel really negative. Actually, use that opportunity to emphasise the things that they can have. So they can have plenty of fruit and vegetables, they can have plenty of starchy carbohydrates, low fat, dairy products, lean meats, fish. There's lots of things that they can still have. And then this is a great infographic to have on your wall, have laminated, to be able to show women. It's got lots of advice around what type of physical activity to do and the benefits of physical activity. And so discuss what they're already doing and build on that. We need to get over this societal thing of pregnant women need to rest. It's not that they need to rest all the time. They do need to do physical activity, and the benefits of that are very strong. And then keep hydrated. I've been really happy to see lots of water bottles, and it is becoming something that society is saying is a good thing. Women need more than the rest of us do who are pregnant, so it's almost 2 litres a day that is recommended for pregnant women. Now, it seems like a lot of water to drink, right? But actually, if you can drink it throughout the day, it's not as much as you think it is. And the benefits of that are huge. So a lot of those benefits are things that you're more at risk of during pregnancy. So things like constipation, things like dizziness, UTIs, hypertension, all of those things can be reduced. I'm not saying they'll completely go away, but all those things will be reduced with hydration. And then from a weight management perspective, actually if we're drinking water then, or having some sort of non-sweetened fluid, then we're actually going to be eating less because our bodies will probably be dehydrated, and so confuse that with hunger and you have the water instead. So really simple but really important message. And it's good if you could have a water bottle on your desk when you're having the conversation with someone about this, to be able to show that role model. My experience from working in the field is the more I can practice what I preach, the more I've got examples that I can show people, and people can see straight through you if you're not actually practicing what you preach. So if you can give examples from your own life of how you've managed to squeeze in the extra bit of water, then that really helps. And then some more detail around where you're going to get those micronutrients I mentioned earlier with the deficiencies. So iron, the classic one, everyone thinks it's spinach that has, and even nutrition students that I lecture to think it's spinach that you get lots of iron from. Popeye has done a great job of lying to us about that. Spinach does have some iron in it, but it's not nearly as rich in iron as something like red meat. The one I haven't put up there is fortified breakfast cereals, have quite a bit of iron in them. Give them some advice about where to get them from. There's some examples there. But the important thing with iron is to have something with vitamin C with it at the same time. So have a glass of orange juice or a piece of fruit with your breakfast cereal. Have some vegetables with your red meat. That will increase your iron absorption. And don't have a calcium-rich food alongside it, because that will decrease the iron absorption. So try and keep your red meat and your dairy products separate if you can, just to try and increase that iron. And if you're eating lots of iron-rich foods, that's not quite so crucial. But if you're on the borderline, if you've got a woman who's at risk or of becoming deficient or is deficient, then that's a really important message to get out there. And then iodine. So if you're having a range of foods, you're not likely to be iodine deficient. But if you are vegan, then you are likely to become iodine deficient. And actually, the recommendation for vegans is to take the Veg1 supplement, which is available from the Vegan Society. The reason it's that one is because certain iodine supplements come from seaweed, which pregnant women cannot have for various reasons, and so that's the supplement that is suitable for them. And there's a dietitian who works at the Vegan Society who can tell you far more about that supplement than I can. Then calcium, if they're not having dairy, things like calcium set tofu or soya milk, almond milk, all have calcium in them, and you get some calcium from green leafy vegetables as well. And zinc, we know that zinc's important, but if you're eating a range of foods, it's fairly easy to get it. If you've got a woman who's being sick a lot, this is something to be aware of, what she's actually managing to keep down, and there might be a referral route that she needs to take with zinc deficiency. And then omega-3 as well, from oily fish. The evidence around non-oily fish omega-3 is not as strong for cardiovascular health, but at the moment we're just recommending that you do take them. So flax seeds, walnuts are non-fish sources of omega-3. That's a whole lot of information. I'm aware that you might not remember all that. Then the last bit of advice is around tailored support for certain groups. So we've mentioned about deficiencies. The basic advice is that if you're not sure whether you need to refer someone, you probably do need to refer someone. And there are certain groups that will need that extra support. So know who the dietitian is that you can refer people to. And I highlight specifically homeless women, refugees and asylum seekers who may not have access to the kitchens or the food that they need, the economics that, to be able to buy the food. They may need extra support so they don't become deficient in things. So what are the opportunities around putting this advice into practice? At your booking an appointment, you will be giving lifestyle advice anyway. So use that opportunity to talk about the things you will be mentioning already. Avoiding foods, about supplementation. Talk about good hydration. You're going to check someone's urine every time they come in. That's a good time to check their hydration. You'll be able to have an easy conversation because the urine sample is right in front of you. It's a good prompt. Praise them if their urine's a really pale colour. Then say that's great that you've managed to keep well hydrated, and if it's not, talk to them about when they might be able to put some extra fluid in their day. Advice about physical activity, micronutrients, and then like I mentioned earlier, make sure you know whether someone's a vegan or has got dietary restrictions that they may need some extra help for. And then follow-up appointments, check they're taking vitamin D. They'll come out of the folic acid bit, so check the vitamin D supplementation. Talked about hydration. If they mention constipation, that's a good opportunity to talk about fruit and veg and whole grain starchy carbohydrates and hydration. And then just ask how they're doing with eating regular meals. Particularly if they're not eating those regular meals, they may well be snacking more, and that will increase the risk of having high fat, high sugar foods and then increase weight gain. And then at the final appointment, all pregnant women need advice about how they might lose weight after pregnancy. They're not going to lose weight as fast as some of the celebrities do, and that's probably healthy. But I'll show you on the next slide why I say all women need this advice. Talk about the benefits of losing weight, particularly if they are overweight at the next pregnancy, then their risks go up, and you'll know what those risks are. But if they manage to lose the weight and go back to a weight that they were at, or even go lower than the weight they were at, depending on where they were to start off with, then they'll have less risk next time. Promote hydration, especially for breastfeeding mums. Anyone in the room who's breastfed will know how thirsty you get when you breastfeed. And actually, that's really important to be able to reiterate that you've been drinking more throughout pregnancy. Keep doing that. Don't stop now. Give examples of quick snacks. This is why practice what you preach is really important, because you'll be able to give some advice about things that you might have had that are quick around your shift patterns. Encourage physical activity and encourage them to seek support from their health visitor when they get to weaning point. So I said I'd show you a slide. On this graph, which you won't be able to see very well at the back, the bottom line is the underweight women, then the healthy weight women, and then overweight and obese. And as you can see, everybody puts on weight during pregnancy, it's fairly standard, right? But they don't come down. They don't come back to where you'd expect them to come back to. And so if you start off a bit overweight, then you're going to become more overweight for the next pregnancy. And so we want to think about the subsequent pregnancies that happen as well as the initial ones. Very quickly, some resources available. There's some fantastic free resources online that are evidence-based. So First Steps Nutrition has a really good pregnancy guide, quite a thick pregnancy guide, but you can download it free. There's one for all pregnant women, and there's one for teenage pregnancy too. There's also information about Healthy Start and making the most of Healthy Start. The British Dietetic Association has fact sheets on fluid and on pregnancy. I've mentioned the Vegan Society already, and then Tommy's too. So it's a whistle-stop tour of the information that you can give around pregnancy to improve outcomes. If you have any questions, please either ask now or you can email me. Very briefly, I want to say thanks to Julie from Liverpool John Moores, who helped me put this presentation together.